Welcome back, counselors, and welcome back to LeeBella Coaching and Counseling. And today we're going to jump right into core function number 8, crisis intervention. Now, crisis intervention, again, it's short, it's easy to look at and go, hey, I got this. However, there are multiple core functions that are referenced within this core function. There's also a lot of ethics, policy, and procedure that you need to be aware of. I don't want to complicate it, and I don't want to go too much into crisis theory, but when you're taking the exam, crisis management more than likely is going to be in one of those case study questions. So you want to be aware of the ebb and flow of crisis intervention. So crisis intervention, by definition, are those services which respond to an alcohol and or other drug abusers' needs during acute emotional and or physical distress. The global criteria are equally simple, at least when you read them. First, recognize the elements of the client crisis. Next, implement an immediate course of action appropriate to the crisis. And finally, enhance overall treatment by utilizing crisis events. So let's look at the first global criteria, recognize the elements of the client crisis. A crisis is an overwhelming event where an individual's usual coping ability, coping skills, and mechanisms, they don't work. They may fail, leading to confusion, anxiety, and a state of feeling vulnerable and or helpless. Crises can include many things, from life-threatening issues that are not like within the next few hours, but it can be chronic illness, terminal illness, it can be physical injury, it can be acute withdrawal. Would definitely be a crisis event for most clients. Losing custody of children, other illnesses, accidents, and an endless variety of events and situations. In addition, the crisis might involve something that the average person might not view as a crisis. The point is that a crisis is anything that causes acute or immediate distress for the client. Be careful of the judgment zone on this one. One of the crises that I remember the most was a client was very, let's just say, very attached to their cat, and their cat went missing. That poor client was virtually hysterical. Clinically, we need to understand that the crisis is whatever the client defines as a crisis. De-escalating, coming up with a plan of action, the whole 9 yards. We had to be very empathetic. We had to understand that this was very important for the client. Watch out for the judgment zone. If you find yourself going, this isn't a big deal, you have lost therapeutic bearing. So when you're recognizing the elements of the client crisis, determine if the client or anyone is in immediate danger. A crisis is different than an emergency, which is generally an immediate, life-threatening situation requiring rapid response. For our terms, a crisis is generally an event or situation that is outside of your client's normal coping skills. Next up, we have implement an immediate course of action appropriate to the crisis. So, immediate course of action varies by situation. Events such as suicidal ideation, injury, and danger to children have clear mandated reporting laws stipulated by federal guidelines, state guidelines, and facility policies and procedures. These types are not optional, and they should generally involve informing your supervisor or your program/clinical director in most cases, and then following written procedures. So if it's a very serious crisis, no matter how long you've been doing this thing, you want to make certain that the clinical supervisor and the people in charge of the facility are aware of it. Other situations might be appropriate for doing an assessment, such as the PHQ-9 for depression, the GAD-7 for anxiety, or even the Columbia Suicide Severity Risk Scale. These are good assessments to know for the other core function that we have for assessment. And like I said, crisis intervention generally involves a lot of different core functions all at the same time. Always remember, if the situation is a matter of life and death, it is an emergency, not a crisis. Next, other crises may involve community organizations such as food banks, churches, Department of Human Services, and other community resources to help resolve the crisis. In this case, you'd also be using the core function of referral. Other crises may involve community organizations such as food banks, churches, the Department of Human Services, or other community resources to resolve the crisis. Some crises, you might need to refer the client to a different facility if yours is not equipped or structured to address it at that time. In some cases, you simply might need additional training or guidance, which would require using the core function of consultation. Most crises, to be honest, are probably going to be resolvable in session. In all cases, review the situation with your clinical supervisor, program director, or another colleague. And as always, document and update the treatment plan accordingly. Finally, we have enhance overall treatment by utilizing crisis events. It's normal for a crisis situation to feel scary, especially at first. And we don't want to overreact, and we also don't want to underreact. A crisis, in general, is a therapeutic opportunity for growth. And to be honest, for both of you in some cases, both for the client and for you as a counselor. Always maintain a warm but clinical perspective. Don't get caught up into the drama of it, and watch out for sympathy. Sympathy is where you feel the emotions and the elements of the crisis along with the client. You want to have empathy, which is understanding where they are at and keeping a clinical perspective. Use motivational interviewing skills and keep in mind that a crisis, like a relapse, can be a great opportunity to help move the client from pre-contemplation to contemplation, from contemplation to preparation, and in some cases from preparation into action. A crisis can always be the critical event that moves him or her into action. So when you're utilizing the crisis to enhance overall treatment, there are a few interventions that you can make. Those include safety planning, psychoeducation, where you simply update the client's information regarding drugs of abuse, the dangers of this, that, or the other thing. You can also get involved in problem solving. Great opportunity for solution-based therapy. You can utilize cognitive behavioral or rational emotive techniques of reality testing. If you know that this isn't really a crisis, for most people, that's a good opportunity to address some of the cognitive distortions that lead to emotional overreaction. Never take a condescending point of view on this. Just understand this could be a great chance to challenge either or thinking, catastrophizing, and projecting, things like that. It's also an excellent opportunity to focus on skill-based counseling, going through how to walk through a problem from one element of the problem to the next. Very similar to solution-based. You want to build the skills, especially the coping skills, and increase their overall resiliency. It's also a good opportunity for referral and support. We all know, and the evidence says, the more stakeholders, the more resources in the community that they have available to them and that they actually use, the better the outcomes tend to be. A crisis can be that moment where they go, okay, I'm going to go attend a 12-step meeting, or I'm going to attend Smart Recovery, or I'm going to take one of those courses on parenting, or I'm going to get financial training. The referral and support possibilities in crisis are virtually endless. And finally, and as always, adjust the treatment plan accordingly. Make sure that you're making full use of your documentation skills. So that's it really for the exam on crisis intervention. You want to be aware of the global criteria. You want to be aware that you want to identify action steps for the crisis, and you also want to make use of the crisis as a therapeutic opportunity for growth. And again, that growth can be for you and the client. That's it for now. I'll be with you again soon with my next core function. If you would like more information or if you'd like to schedule one-on-one coaching with me, check out my link below to Psychology Today. And other than that, I look forward to making more comment, and I am committing we're going to double, maybe even triple our output over the next couple of months. I want to get the 12 core functions done well before the end of the year. As always, thanks for tuning in, and I'll see you next time.